the January 20th Ridgecrest. We're going to go ahead and call this meeting to order. Again, this is our technical development, so if you have anything close to a microphone. I apologize. My mic was not turned on. Once again, welcome. This is the January 20th session of the Ridgecrest City Council meeting. We're going to go ahead and call this meeting to order at 6:01 p.m. Roll call vote.
Mayor Bruin.
Here.
Mr. Maurer.
Here.
Mr. Heyman.
Present.
Mr. Blades.
Here.
And we have Mr. Rajaratnam by phone.
Yes.
We have 5 present. We have a quorum.
Great. First item of action is the approval of the agenda for our session today. Do I have a motion for approval of the agenda as presented?
So moved.
Second. I have a motion second. Roll call vote.
Mayor Bruin.
Aye.
Mr. Maurer.
Aye.
Mr. Heyman.
Aye.
Mr. Blades.
Aye.
Mr. Rajaratnam.
Aye.
5 ayes. Motion carries.
Great. We'll go ahead and begin our regular session with the Pledge of Allegiance. Can I ask everyone to please stand in honoring our country? Ready? Begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I don't have somebody for the invocation again. Is there somebody who'd like to say something? No volunteers. I will go ahead again. In the name of the Father, Son, Holy Spirit. Dear Lord, look over this council, look over our decisions this evening. Look over our new president and welcome into his new office today on January 20th. Look over our community and continue to keep them as healthy and safe as possible. And thank those leaders who continue to work hard for the benefit of our community. In the name of our Father, Son, Holy Spirit, amen. First up today, we have 2 presentations. The first is a requested presentation on COVID-19 and an update from our local hospital. I believe we have their director, Mr. Suver, on the phone. Is Jim, are you on the phone?
Yes, sir.
Hello, Mr. Suver, and thank you for joining us this evening.
Thank you, Mayor, for inviting Michelle and I.
I apologize. I didn't know Michelle was on the phone. Thank you, Michelle, for joining us as well. If you guys would feel free to go ahead and give us an update on the current community conditions as COVID-19 works its way through. I certainly know I've been dealing with it from my business perspective, and look forward to hearing something.
Certainly. I'll do a brief intro where we are. Michelle is our expert on vaccinations, and so I want to give her as much time. We, believe it or not, have been significantly impacted by COVID. We have had basically during the last 45 days or so more than twice the patients we normally have at this time of the year. We've exceeded our capacity on many, many days. Our staff have been working great, many extra shifts, lots of overtime, people really chipping in. So shout out to the staff at Ridgecrest Hospital for doing a job in a very, very impossible situation. The good news is a lot of our COVID people are getting better. And we are still seeing some upticks, so I don't want to say we're starting to see a decline yet. But we are hoping that within the next couple of weeks we'll start seeing a decline. Our positive rate at the hospital from tests done on the outpatient side is higher than Bakersfield. Actually, it's a percent of the tests we're getting back that are positive. To do that. So the good news is Michelle and her crew have done a great job rolling out the vaccine. Please, everyone, remember, just because you're vaccinated, you still need to wear a mask for a while. We're not out of the woods yet. We are watching very carefully the new strains of virus that are coming, and hopefully the vaccine will be effective against them. However, there's differing reports on how that might happen. But we are holding our own, but it's only because our staff have just really done an incredible job keeping our patients taken care of both on the inpatient as well as the outpatient side. But, Mr. Mayor, if I could turn it over to Michelle Wally, unless you had any questions directly for me.
Does not appear so. Go ahead and let Michelle make her presentation, and we'll see if there's any after that.
Thank you, Jim.
I believe Michelle has a PowerPoint.
Good evening. Hi, can everyone hear me?
We can hear you very well.
Great. So I did send a PowerPoint along, and I'm certainly able to talk, without that. We have, sorry, my cat's, of course, now going to meow, so nothing like Zoom and WebEx at home. We do have quite a process going, as a result of all things COVID. We started out the year, as everybody knows, following a year preceding that had earthquakes. And while a public health emergency and a worldwide pandemic of this, magnitude is not something any of us hopes to ever endure through our careers, I think our casualty and disaster preparedness experience that we've had at the hospital has really positioned us well in our ongoing response to COVID. We all very much want to, continue to blanket and umbrella the community as rapidly as possible with the vaccinations so that we can all begin to move forward with a little more confidence. I think the public health emergency in large part has been all about resource challenges. And I think that that's not unique to healthcare, but it's certainly from, the seat I'm sitting in that has been, where we're at. I am pleased that, the focus on the vaccines early was a priority, because I do think that it allowed us to be ready as an organization. We knew that there would be a structure and a hierarchy. And in fact, we were making our own plans so that we could roll that out. Will I be able to use the presentation, or should I just kind of continue to give you an update?
Yes, ma'am. It's up here, so whenever you're ready, just say next page.
Okay, great. I can't see it, so I just wanted to make sure the City of Ridgecrest screen is black, and I'm not sure.
Okay, I'll go back and talk to IT while you proceed.
Okay, so essentially, our planning began in earnest in November at Ridgecrest Hospital, and at a higher national level, our government developed a task force, and they procured and made sure that there was a structure and a hierarchy to roll out vaccines as they were developed and approved. And on December 11th was the first vaccine by Pfizer Pharmaceutical to get emergency use authorization from the FDA. And as a result of meetings with the CDC, they granted that permission, which allows during a public health emergency for medical countermeasures and other countermeasures to be used, including vaccines that have not undergone 2 years of full trials. So Pfizer had been in production and was ready to ship vaccine as soon as that emergency use authorization was granted. And so I hopefully am on the screen that's talking a little bit about vaccines. But there were 9 vaccine production companies in the race for vaccine, and Pfizer just happened to be the first in the United States that our government decided to procure. So on December 11th, we had approval. On December 16th, Kern County Public Health took delivery of their first supply of that vaccine. Am I on the slide talking about week 1?
Yep.
Okay, great. And so we did receive via courier the Pfizer vaccine the week of Christmas, which was really exciting. We had a courier come from Kern County Public Health. The Pfizer vaccine is required to be frozen at an ultra low temp of minus 60 to 80 degrees Celsius. Ultra low temp freezers are something available in healthcare, but as I discussed earlier, resources and different supply chain issues are always a challenge. And so while Ridgecrest certainly, as well as many hospitals, wanted to purchase one, they're not something that was immediately available. Larger hospitals certainly carry, tremendous vaccines and medication supply, and so had those. And our county had an ultra low temp freezer. So they shipped our first doses to us via courier. And once they come out of that frozen state, we have 5 days to use the vaccines. We did administer 200 vaccines that first week to our frontline healthcare workers and first responders in the community. So that was the beginning of our effort. My next slide, please. The second week, our efforts were to vaccinate with the Moderna vaccine. That obtained emergency use authorization on Friday, December 18th. And once again, our county rapidly received supply, as did all of the states and counties within the U.S. Our allocation was given to us, and so we began to vaccinate on even a larger scale. That, again, went well, and we carried on with our efforts into the following week. I'm going to go back. Am I on my third slide?
You're on week 3 slide.
Great. Sorry. Just going to. I do apologize. I had a little glitch and my page has gone away. So I'm not able to see my presentation, so I will just carry on. The vaccine hierarchy within the California Department of Public Health and the vaccine workforce that they established really attempted to risk stratify who needed vaccines first to provide the best protection. And the healthcare workers and the first responders were clearly in the first phase. We've done a tremendous amount to vaccinate at our hospital. By the conclusion of this week, we will have completed not only upwards of 1,200 vaccines, 250 of those are second doses. So 250 individuals in the community actually have full vaccine on board, 2 doses. We are in the process of working to do some outreach. We went to Belisara, our skilled nursing facility, and also High Desert Haven, which is another facility that has a high-risk population. I think it's important to know that as a hospital, we had to contract and go through training and really establish a relationship with the county and agree to follow their requirements. The intention at the federal level was for skilled nursing facilities and those high-risk residential populations to be covered by our pharmacy partnership program, which essentially was a contract with our large corporate, pharmacies in the U.S., Walgreens, Rite Aid, CVS, et cetera. They did get off to a very slow start. There was quite a delay, and we were concerned about that, specifically with regard to Belisara, which the hospital does operate. We happen to be, one of the few skilled nursing facilities that has had no COVID outbreaks in the facility, and that's a pretty important population to keep safe. So as you can imagine, we wanted to keep pursuing this. We did reach out to Representative McCarthy's office, our board of directors, our hospital leadership, and ultimately the consultant that was working with the county was not able to meet our needs, and the county did grant us authority to go ahead and vaccinate those 2 populations. So they allocated us additional vaccine, and we completed those over the course of 2 days, and so that's really fantastic. And this coming week, we'll deliver the second doses to our Belisara residents, and the following week, the second doses will be delivered to the High Desert Haven population. And then, next slide, we knew that the next thing to happen per the phases and tiers within the structure had been laid out would be to start to vaccinate individuals age 75 and older. So we had thankfully been making plans. We knew that just as we had done our drive-through for COVID testing, and just as we've learned to do everything at scale, that we would need to really, make a big effort to try and start the vaccination for the population that was next in line. So while we were prepared for that, the state came down with a mandate to just actually accelerate that. And so they opened it up to 65 and older. So we switched gears a little bit, but we did gear up, and we were able to do a test run on Friday, this past on the 15th. And our drive-through process was successful. As you get your vaccine, there's a recommendation that you be monitored for 15 minutes. So that did add a bit of a change to how we wanted to approach it, to make sure that we were ensuring safety of our, patients that were coming to get their vaccines. And it went very well. And I think we've been trying to get the word out on social media, on the radio, and in the newspapers regarding, interest and the volume of interest that we're receiving. We have been fielding thousands of phone calls, folks wanting to schedule those appointments. So we are actually booking appointments more than a week out. We're doing it an all-day event. And Monday, just past the 18th, we vaccinated 110 individuals through our drive-up service, and that went extremely well. Unfortunately, as we were in the midst of that day, having had a full week ahead of us, we received word that the California Department of Public Health had placed a hold on a Moderna lot of the vaccine we had just received. And actually in California, 330,000 doses of this particular lot were distributed statewide. The state is working through an isolated incident where there was what they felt to be a potential, risk, to this lot of vaccine. However, it was a very isolated event, and so they have not told us to destroy the vaccine or to send it back. They've just asked us to pause. We're confident that they will resolve that, but of course it could not come at a worse time, just as we had given everybody this great expectation and hope that they were scheduled to get their vaccine, for us to have to tell them that we're having to take a pause. So we're working closely with the county. I had an update today from Public Health that their vaccine shipment is due to arrive, and that the distributor was able to confirm that it should not be the same lot number of Moderna. So we should be in a good position to be having more vaccine delivered, and we're ready to resume our vaccination efforts. It's very important that we do this to, on behalf of the hospital. We provide health care, and it's not, I can't even imagine what, the times of polio would have been like, but, this is unprecedented in the terms, of wanting to get this vaccine out to start to begin turning this curve towards being protected from this virus, and away from us caring for people who are very, very ill with it. We do have, each week a cycle of individuals who will now be due their second doses of vaccine. And so we're beginning to layer, as each week progresses, more and more process over on top of itself. And it is a very resource intensive process for us to staff, but our nurses are doing a tremendous job. We're certainly in a position, I think, as a hospital, to know how to provide this service. And so we're anxious to get back to doing that. This whole COVID, response from start to finish, I think, is going to be one plot twist after another. And I think that this vaccine delay will be short term, and we will be able to resume quickly. So if you do see or get any questions regarding that, we would just ask folks to please be patient with us. As soon as we get the green light, we will be back at it in full force. And California is a very large state, and they've received upwards of 3 million vaccine doses. And as of the 17th, I believe it's 1.4 million doses have been delivered, knowing that a second dose is, of course, required. The state has a lot of vaccine. We're hoping that Moderna will work with the CDC and our state to their satisfaction. It would be just a shame to have to, not be able to utilize that vaccine, but we've been very, very fortunate. It's gone extremely well at Ridgecrest. We've had no significant adverse events or reactions. We'd like to keep it that way, so we're, of course, being prudent and following their guidance. But we're in a really, really good position to continue to roll this out. We estimate there's probably 5,000 individuals in the community that are age 65 and older who would be eligible. And the very next tiers within phase 1B will include educators, childcare providers, food service workers, and a whole host of the infrastructure that we know it takes to keep a city and community running. So we're really hopeful that we're going to be able to gain steam right back. We were just, so disappointed on Monday. But the team will rally and we will take care of the community. Ridgecrest is very unique in, of course, I'm a little biased because I do work at the hospital and I care very much about the work that we do. But we are uniquely, positioned to be able to provide services like this for the community. I was reading a statistic that something like 30% of all counties in the U.S. have only one source of vaccination, and that's pretty much the scenario that usually happens in Ridgecrest. I do want to let the community know that I've been advised that Omni Healthcare will be starting to operate small clinics, and I believe CVS Pharmacy in our Albertson South location are vaccinating. But I do believe the hospital will be the larger scale source of vaccine for our community. So through clinic medical appointments and our drive-up service and walk-in clinics that we've been conducting for the community and our employees, we hope to be able to have vaccinated, in high numbers just as soon as we get that vaccine back in our hands.
Thank you, Michelle, and I appreciate it. Is there anything else, Jim or Michelle, that you'd like to add? If not, are there any questions from the council?
Go ahead, Doug.
Yes, this is Councilman Heyman. I have a couple questions. Of the 1.4 million doses that's been administered thus far, is there any tracking of the number of adverse reactions to the vaccine? And, if so, is any particular age groups or pre-existing health condition groups?
Yeah, and I could barely hear you, but I think you were asking about statewide numbers of reactions.
Yes.
Yeah, so we all report those through a national database. And other than this particular cluster from this one batch, there have not been significant, levels of reaction. There very much have been what were anticipated to be expected reactions, which are, generally fatigue. You might, just as with flu vaccines and other vaccines that you might get, in due course, you might have mild, sets of symptoms that mimic the infection that you're attempting to inoculate. So as a healthcare workforce, we did have less than 10 individuals who needed to take partial day off or go home because they were, a headache or fatigued or, just not generally feeling well. But all reported, to be doing just fine and returned to work the next day. And so that out of a, group of, 200 to 300 that we've given second vaccines to seemed to be when the greater sort of immune response like that was happening.
Okay.
But generally, it's been going extremely well from everything that I've read, statewide as well as nationally. So
okay, very good.
You can expect to know that you got the vaccine, but hopefully, everybody will be able to tolerate the mild symptoms with the knowledge that they won't get the full disease.
Okay. Thank you very much. And my second question is, so a person who receives the vaccine, are they or can they be an active carrier of the virus after having been vaccinated? And is there any knowledge as to how long of a period can the virus be active in a person that has been vaccinated? And I guess I'm referring to like
the studies that they have been conducting, and of course the only thing that you can do once you've been vaccinated would be to do lab tests and serology to look at the level of antibodies. And they are able to distinguish between antibodies versus the actual disease. And so yes, you can still get COVID if you've been vaccinated. Of course, it's a matter of percentages and averages. So clearly most won't, but those who do get it, they actually are not, entirely, being, because it's new in the process of this vaccination. And now that it's out there on a larger scale, I think they'll have more data sooner than later. But they are not sure if it means that you could carry or if you could shed the virus, but it certainly means that you will get a protection from your own self with respect to you getting a bad case of it. Okay. So, you're best to get vaccinated to protect yourself. And as we all begin to protect ourselves, it's less of a concern if you get it from someone else. And so
it'd be safe to say then that if a person is vaccinated, that they should still take the precautions as if they could possibly
absolutely. And I think it's interesting to note that this year, our urgent care volume and our ER volume, we've seen a tremendous amount of COVID. I mean, just that is the singular reason to bring folks in, whether they're symptomatic or whether they've had exposure, whether they have it mild or whether they have it serious. But what we haven't seen this year is flu. And so I think it just goes to show you that, masking, hand hygiene, isolating yourself when you don't feel well, those are very much the things we need to keep doing so that it gets a chance for us to get ahead of this in all respects. From the isolation standpoint, everybody wants to get back to living, when we can cover folks with a lot of vaccine. And, we can actually get ahead of this. And that's why the urgency is there for this vaccination effort. So we're hopeful we can, be that resource for the community and achieve that in short order.
Okay, very, very good. I appreciate it.
Michelle, this is Kyle Blades. I have a few questions for you, if you don't mind.
No, of course.
So to build off of what Doc was asking you, so about antibodies, how long do those stay in the system generally?
Everything that I've been advised is that this will become an annual, requirement for vaccination, just as with flu. These viruses mutate and change over time, and because it is a virus of the nature of a flu-type SARS virus. I think every expectation from an epidemiologic standpoint is that we will probably be having an annual dose of this until things change drastically.
Understood. So then, I guess in that same vein, I know that your general guidance is people should wear masks, people should distance. What is your, what is the hospital's take on, the mask utility? Let's just say indoors or in all the various scenarios we would find ourselves.
Yeah, to the extent that you can stay, masked and away from folks who are visibly ill. I mean, obviously that's the goal. I think the problem that we've had with COVID is, as they start to track data, we'll know more about how early folks are symptomatic, or shedding the virus before they're symptomatic, how much community spread was happening from asymptomatic carriers, all of those things are, the data collection is happening rapidly. It's just, been a very, very tricky tricky thing. If you want to rely on something you read, we may have to wait. But what I can certainly tell you is that, children not having been in school, as difficult as that has been, we have not seen in our pediatric population acute illness this year at the levels that we normally would. I mean, it's drastically reduced, almost non-existent. So, the social isolation is difficult. But I do think that it's definitely what we need to do when we are sick. And when you're in public, hand hygiene and masking, hopefully we all have hand sanitizer and, a way to wash our hands or be cautious after we've been out in an environment, because they do know that this virus can live for significant periods of time on surfaces. So between contact with your mouth, your eyes, that type of spread can happen, as well as someone who's sick and coughing. And so, we're watching very closely our hygiene practices in the clinic, and I think we would encourage folks at home to just remain vigilant and, keep your hands clean and try not to spread it. Hopefully, like I said, with the vaccinations, we will get ahead of this.
Right. Thank you for answering all these questions.
Of course.
I have a few more. There's things that I want to reiterate. The hospital had given presentations early on when COVID really started to hit the city, and we'd asked all these questions, so I'm just trying to reiterate a few things for the public. So if somebody has, how long would you, what is the normal period of time somebody is asymptomatic to the point to where, a test will turn up positive? Because it's also my understanding that sometimes tests, you can have false negatives and false positive with tests. And you could be carrying that and shedding that virus for a few days, for a while, and off to other people.
So just to make sure you all know too, I just want to clarify this. I'm not a nurse and I'm not a doctor, but I do, intently participate in the, our incident command structure, and our emergency room medical director, Dr. Crapo, has been at the head of our charge with Brenda Deal, who's our quality nurse administrator. And what I can tell you is that from the testing standpoint, we've actually had almost statistically, no false negatives. What you tend to see is that once exposed, or once with, you actually have the virus, until you have a viral load. And generally, if you've been exposed, they would recommend that you defer testing for 3 to 5 days, because the sensitivity of the tests are what is, it's not truly a false negative. It's that you were probably tested too early. So we do that with our employees. We do that with individuals who may come and seek and say that they were exposed to someone that was positive on Saturday, and they're in our urgent care on Monday, and we might tell them, please come back on Wednesday or Thursday and we'll swab you, because that is when, the viral load will be detectable on the laboratory serology and PCR testing. So it depends on what type of test you're getting and the presentation. But if you're clearly symptomatic, testing is usually confirming that it's COVID and not something else. And we have a variety of tests that we run, and one of them does test for 3 or more different types of scenarios. So it would be testing you for flu, it would be testing you for COVID, and it would be testing you for strep, so we're able to rule out that you might not have something else. But we just really haven't seen those infections this year. We've seen COVID. I think we've had maybe 1 or 2 flu positives, and some very small numbers of strep throat, where normally that would be something that's in our pediatric population very heavily. So I don't know if that answers that, but, the false negatives oftentimes are just because they've been performed perhaps at the timing when clinically you're not yet at a viral load where it's detectable. But it doesn't mean you don't have it.
Sure.
And that's where someone a couple days later might get a follow-up test and they do have it. And that's why they're recommending that if you are exposed, that you do your best to not quarantine, but to behave as if you may be, potentially carrying it. And once you are confirmed, we do recommend that you isolate until your symptoms have resolved. And symptoms resolving means you haven't had to take medication to control a fever for over 24 hours and that general symptoms have resolved. I think we all know that, the symptoms never resolve overnight, and that's why they were recommending 14 days. But the CDC has revised that down to 10.
Thank you. And lastly from me, hopefully you don't get too much else from the rest of the council, but last from me, since you guys are doing a very good job about mobilizing and doing vaccinations, it's halted. You were doing the drive-through vaccinations. Is the best place to get the information on when those will resume on your website? I know that I've personally seen stuff through social media. That's been great. I appreciate all that you guys have done till now. So what's the best source when things are back up and running and that population of 65 and older can start getting vaccinated again?
Well, they're actually all on our wait list already. So we will be calling them to resume because they were scheduled and we had to call them and tell them that we're keeping their space in line. They'll be, the very next day. If they were scheduled for Tuesday, they will be our first day. And if they were scheduled, for there on. But our primary care clinics are also doing outreach to their patients. Dr. Mosen, our cardiologist, is going to start conducting small clinics for his patients. But yes, social media, we have been working on something with the newspaper. It's been hard to keep up because they change things, or as soon as we put something out to press, then it changes. So yes, I think the hospital website, we do press releases there. And if you have access to our Facebook or Instagram page or LinkedIn, that's always a great place to get that. We could certainly consider if there are any other resources in the community. We try to do outreach to the groups and agencies that we work with so that we can let them know when it's their turn as well, because we're anxious to get education and childcare and, our food service workers as well, all of our grocery stores, it would be wonderful to know that we're able to do that. And we do think that we could at our best, once we get this up and running, potentially be vaccinating 700 to 1,000 people a week if all of these things perform as hoped. And so get us some vaccine and we're ready to go. We'd much rather vaccinate and use our resources that way than care for people once they've got the disease and have to be in our hospital.
Thank you much.
Yeah, and we could certainly let the city know if, again, there's word on the street. We all have connections, and that's always the best way. But we, obviously with high volume, we're going to attempt to, do the best we can to cover and blanket this as quickly as possible.
Michelle, this is Mike Maurer. I just want to relate an experience I had with the hospital and encourage people to have some patience. I had a doctor's appointment this morning, which I needed a blood draw for, and the phlebotomists are spread so thin that even though I had an appointment, there was no one there to do it. So I finally got my blood draw. The employees of the hospital are doing their very best to service all of us under these trying times, and many of them have gotten sick also. So I just want to ask the public to be very patient when they're dealing with the hospital. I've had nothing but good service from the hospital, other than because they're spread so thin, there's some problems there. So if you're going to get something, please show patience to our wonderful people that are serving us so well. Thank you.
Thank you.
Solomon, do you have any questions?
I'm good, thank you.
Okay, thank you. I want to go ahead and just reiterate what Councilmember Maurer had to say and apply it to the community as a whole. COVID-19 has been an experience for all of us and a moment in history in many, many ways. And that patience that he spoke of for the hospital staff, these are people that are working diligently with one purpose in mind, which is to take care and protect your health. And they deserve the respect and as much of your patience as you can offer. And I encourage you to offer the same to anybody out there who is deemed an essential worker and out there working for your benefit as we are working through this. Nobody's enjoying this. Just remind yourself of that. In the moment that you're feeling frustration, remind yourself to put yourself in the seat of the person on the other side of the table that is going through it with you and the challenges that they are facing. And once again, to Jim and Michelle, thank you for taking the time today to come out and let us know some of these details, to answer our questions. And we are deeply appreciative of.
Did you happen to have any? Does the public have anything? Or
I believe based on time, I'm going to go ahead and move forward. Okay. If there's a public that would like to call in during public comment, we'll certainly provide them the opportunity to, but it'll be during public comment.
And my email is on the presentation, and I would be fine to invite anyone to email me with questions.
Thank you.
Okay. Thank you, everyone.
Thank you. Next up on our agenda today is the presentation. This is Chief McLaughlin is going to give us an update on crime statistics as requested.
Moment. Do you want to give that a shot, Chief?
How about now? There we go.
Hey, technology.
Yes, tonight I would like to give an update on what crime looked like during 2020. Go ahead and switch it, Gary. Go ahead. Okay, so total incidents, we had 35,996 incidents through that year. In 2020, we're a little bit higher, or 2019, we were a little bit higher. We had over 36,000 that year. Total calls for service in 2020, we had a little over 23,000. Not much higher in 2019. 23,657. We did take more reports this year. We took over 4,200 reports, and just a tick over what we did in 2019. Arrests were up. This year in 2020, we arrested 2,629 people, as opposed to 2,311 in 2019. Drug-related arrests were way up compared to the previous year. On this chart, it's a breakdown of our Part 1 crimes. Only a couple of them went up. For the majority of everything went down. Overall percentage of total Part 1 crimes reduced about 11%. Some of the ones that rose, I'll get into here in a minute, like robberies and things like that, auto theft. And it seems that everything that we experienced, pretty much the rest of the agencies in California are kind of reporting similar type things. Our property crimes decreased from 406 to 326, but of the thefts, I just picked out one of the largest ones, and probably the most preventable, is theft from vehicles. So the estimated dollar amount stolen from vehicles last year was almost $200,000. So something as simple as don't leave valuables in there and lock them, it really will work. Our violent crime also decreased. And robberies, broke down what each one of them, what was used in each one. In 3 of the cases, a firearm was used. One case, a knife was used. In another one, another weapon, could be anything. And then in 14 of them, physical force or what we call strong arm type robbery occurred. And many of these can be anything from taking a bicycle to refusing or using force to get out of the store when they're stealing something from the store. And I already went over the decrease from 835 to 743. Our traffic trends, our injury traffic collisions went down quite a bit. There for several months we didn't have a lot of traffic on the road. We did have 2 fatalities this last year, and then we had 18 DUI-related injury traffic collisions, as opposed to 27 in 2019. Domestic violence, I've been asked a lot about this one from everyone. So in 2019, or 415 domestic violence incident reports, those are reports if 2 people are arguing and there's no physical, there's no crime really, we still document it. In 2019, we had 298 of those, and 2020, 300. And all other could be, significant abuse or misdemeanor type abuse. So we did see a rise in those from 347 to 395. So our totals were 2019 645, and then in 2020 we were at 695. So we did see an increase in some of those. And I did a mid-year just to see what we looked at right at the onset of COVID, the lockdown through June, and then June through December. And in most cases, there's not much of a change. The assaults is about 29 higher, and total violent crime about 51 cases total. And thefts are obviously 10 cases higher, and auto thefts are about 3. So I was surprised. I thought it was going to be higher the second half, but it's not as high as I thought it was going to be compared to the beginning when we were locked down. And with that, I'll take any questions.
I'm the one who requested you have that on, and I appreciate that. We have a large part of our budget that goes to police, and I like the people to see that the police are actually out there in the streets doing things. And it seems like every time I go out for a ride, I see at least 1 or 2 officers out, and some giving tickets and what else. But I just think it's important that the citizens realize that we do have a great police force that is out doing their job. Thank you.
Thank you.
I just want to add that I want to commend the Ridgecrest Police Department for their hard work and for their current hard work also, where the latest report that came out on the operation that they had done with the I don't know what term to put in their child molesting law, but anyway, I think it's fantastic work, and commend everybody involved in that.
Thank you.
Solomon?
Yes, Mayor. It looks like overall crime rate has decreased, but in one area, as Chief has mentioned, the drug-related crimes have increased. So is there any reason why that has happened, and what measures can we take to contain that?
I'm not sure why why it's become so rampant. I can make my assumptions that, it was hard to find the actual number of how many people have been released since COVID-19 started. The last number that I was able to find, and it's an older one, it's somewhere between August and October, was about 17,500 was their preliminary estimation on who's been released. So the first time in, I forget the year, I think it was early 90s, maybe even the 80s, California actually dipped below the mark that, and it's over 100,000, but I think they're now down even less than what they estimated they were going to be. So obviously those are a lot of people that have recently got out. I don't know what, most of them were in for, but just like any community, we've seen our influx come back. And I think the stress caused by everything going on, I'm sure has led to some of the increases in substance abuse. So there could be a variety of reasons. Now pretty much with COVID going on, there's a lot of cite and releases that happen that we don't book into the jail anymore because they're not accepting them, so we'll just cite them out here. And so they never dry out, so I think that's part of it as well. So I think there's a lot of factors that have played into it.
Thanks, Chief.
I have no questions. I just want to go ahead and reiterate what the chief said about we are in a unique time, and we have had an influx of release on the state level, and that will trickle down like anything else. I think it's a testament to his force and to the city that we haven't seen a rampant increase with that level of influx. It, again, shows the value of our incredible community out here in the rural desert, but it also shows what a natural policing community does to make it a safe community. What the chief is saying is take your purses out of your cars.
Yes.
Guys. I know it's real easy to imagine. It's still Ridgecrest 1980. Take your purses out of your cars. Take your phones out of your cars. Don't leave your kids' iPads in the cars. And do your best to help the problem, and we'll be continuing to support our police force in getting the best that we can for this community, because crime is not something that you can magically wave a wand and change. The best we can do is to change our mindsets in terms of protecting ourselves.
That brings up a question I just had. On auto thefts, burglaries, did some of them have broken windows, or most of them because we left the cars unlocked?
The majority is cars left unlocked. You'll have a few where they'll break the window if they see something worth taking, because it is a risk to create that noise. So the majority are unlocked. As far as vehicle thefts, those we had a couple people do probably the majority of them, and they were unlocked, but there were other circumstances that led it to make it very easy to take. So if you lock them, it's a deterrent. They'll move on to the next thing. And the last thing, if you don't mind if I add, I know that the kids are having struggles throughout this, and we've been asked a lot what to do for, the kids that are stuck not seeing their friends and all that stuff, and, just ask that everybody pay attention to your kids, and if they do need help or you need resources, reach out and we'll help you, put you in contact with the right people.
I wanted to ask you too, Chief, do you think that some of these crimes with the drugs and the theft is attributed to the Prop 47 and 50 measures that were, passed a while back, and that we're still seeing that trickle down from that?
Yes, sir. I think that's a factor. If you look at right before those laws were passed, it was one of our lowest years ever. And as soon as those were passed, we've been on the gradual uphill slide ever since. And so it'd be hard to say that those don't contribute to it.
Fair enough. Thank you, Chief. We appreciate your time. Thank you for bringing that report to us. Next item on the agenda is public comment on items not on the agenda. Persons wishing to address the council on matters that are within the council's jurisdiction and do not already appear on the agenda may do so at this time. Pursuant to the Brown Act, the city council may not take action on any item that does not appear on the agenda. Speakers are limited to 5 minutes, and the public comment section of the agenda is limited to a total of 1 hour. Each speaker is asked to provide his or her name. I believe we have the blinking light. Nope. I can't, that blinking light is throwing me off. Okay, I'm going to give it a moment. There's a little blinking green light right when in my eyesight, and I think that's it.
You got a call coming in.
Call coming in. Okay, caller, state your name.
Yes, my name is Michael Neal, and I would like to make a few comments on various aspects of the little tirade by Mayor Bruin at the last meeting. First and foremost, I'd just like to say that his inclusion in that of, Mr. Matthews, a gentleman who's old enough to be Mr. Bruin's grandfather, that's basically just disgusting to hear that. And all that indicates is that Mr. Bruin really hasn't achieved the level of maturity he ought to have achieved for his age. And so I guess that's the kind of thing we're going to get to hear, coming from our council diet. And that's really sad, but, that's just what it is. As for myself, he can say that kind of stuff all he wants. I found it actually fairly comical. I didn't think his ghost speechwriter did a very good job, but I hope you keep it up because then he'll probably be able to be done with you in about 2 years after people see enough of that kind of thing. One thing that was a little disappointing to myself personally, just as far as the other council members in this, there is such a thing as consent by silence. And I got no contacts. I've heard nothing from any of the other council members after this little tirade, attempted slander on a citizen. And I guarantee you, if I was on the council and one of the council members tried to slander a citizen like that, there'd be a big, loud, long argument over that. So I hope that the rest of you aren't actually factually indicating that you actually agree with that kind of conduct up on the council dais by not saying anything about it. But I'll leave that to you to indicate such. Now, on a higher level, let's talk about what each and every single one of you have sworn to do in the manner of upholding and defending the law that governs your behavior and mine in this state, the California Constitution. You really ought to go read this and think about it. Section 2 of the California Constitution says that every person may freely speak, write, or publish his or her sentiments on all subjects. And it goes on to elaborate further. It also says that the people have the right to instruct the representatives, and they can assemble freely to consult for the common good, which means I get to say what I think about things, and it's actually supposed to be regarded as an instruction to the council members, according to the California Constitution. In Section 3, it also says that each local agency is required to comply with the Public Records Act and the Ralph M. Brown Act. Now, what does the Ralph M. Brown Act say? Read that, Government Code 54950. There's a lot to it, but in the very first sections of it, you get the gist and you get, a clear indication of the spirit of that part of the law. It says the legislature finds and declares the public commissions, boards, and councils and other public agencies in the state exist to aid in the conduct of the people's business. You're conducting the people's business, not your own private little pursuits and wishes up there. And it also says that the people do not yield their sovereignty to the agencies which serve them. And lastly, in that one paragraph, it says the people insist on remaining informed so that they may retain control over the instruments they have created. That language means that the council and the board that you sit on and you yourself as representatives are instruments of the people of Ridgecrest as representatives. We're not your subjects. People who sit there with this thought in their minds of they would be king, you're just thinking about it all entirely wrong. You're up there to serve the people of Ridgecrest, and that's your sole job, and that's what you supposedly swore that you would actually do. That's the law that governs you. And, oh, by the way, when you violate the Ralph M. Brown Act, you commit a misdemeanor, and you can be charged as such when you do such things as say you're going to refuse to listen to people, and so on and so forth and so forth. So go ahead and continue with that kind of stuff, Mr. Bruin. It doesn't affect me in the least. I have a right, as I just delineated under California law, to speak at public meeting, and the only reason I do so is because I do have a right, and I think it's people's duty to do so. Would that we had 30 or 40 more people down there at every meeting, you might hear a whole lot of things you didn't like to hear, but that's, good for you.
We have another caller. Caller, say your name. We have another caller.
Hello.
Hello. Caller, say your name.
Hi, Dave Matthews. Just real quickly here, to start with, we still got the audio problem. Mike, Doc, can't hear you. Get to the mics. I had the volume turned up so I could hear you, and then when Solomon came on, it blasted my speakers into my ear, and I had to turn it down again. So get to your mics. I wanted to mention earlier when we had that Michelle on from the Ridgecrest Hospital that we're hearing contradictions again. Earlier in the year, last year, the CDC said that there was no problem with the surface, and that was in writing. I saved it at the time. I don't know if I still got it or not. Now they're saying that it does live on the surfaces. Well, make up my mind. But as far as the vaccination is concerned, they can have another one because I'm not going to get one. And I have all kinds of breathing problems and other problems, but I have not gotten a flu shot since 1978, the original swine flu, I think it was. And the reason, because before that, I was always getting the flu every time I got a flu shot. So I have not had the flu since then, and so they can have it again. I was going to mention that we got to quit meeting like this. That was my original intent for this evening, because there's all kinds of problems with these technologies. They're just not working. First of all, the website that is listed on the council agenda, meeting agenda, Adobe Acrobat won't let me link to it. So I don't know why, but it doesn't. So I have to run around, get the website up, and do all the other stuff. I wanted to sit in on the economic development meeting last week. I went to WebEx, went to the agenda, did all the stuff. The system wouldn't take the numbers that I was punching in. And finally, I just clicked, and it linked me into the meeting. And by the time I got in, I discovered that they were already under discussion with the review of the outfit that they've been getting their annual report for. And I thought, this is ridiculous. They're reviewing a report on a year that hardly any business was going on, so I just cut it out. And but the systems that we're having to use are not working. That's a flat-out period. And we need to get things back open where we can come in. We can sit 6 feet apart, just like you guys are doing. We can wear a mask, just like you guys are doing. Well, some of you. And there again, the two are supposedly mutually exclusive. You don't have to do both. But I got to admit that yes, the double protection is good. But anyway, that's all I got for tonight, and we'll bother you the next time. Bye.
Thank you, sir. Do we have any other callers? No other callers. We'll go ahead and move on with the next item on our agenda. That would be count. I slipped my finger across it. Okay. That would next be council announcements. Any council announcements? Mr. Maurer?
I'm sorry, Dave, I was within 2 inches of my microphone. I'm sorry you couldn't hear me. I've gotten a couple emails concerning masks, and I just want to comment on my feelings about masks. I wear this mask into and out of this meeting. I don't wear it sitting here for a couple of reasons. Number one, I've had cases where it's muffled voices, so I couldn't hear them totally, and I like people to see my inflection in my face as I'm talking. I wear this mask anytime I go into any business. Now, I'm retired now, so I sit home most of the time. I'm not getting exposed by very many people. I went to Walmart with my wife the other day, probably got more exposure there than all the rest of the week. But I'm sorry that some people think I'm ignorant or don't care about anybody else because I'm going to expose the whole community by not wearing my mask at a council meeting when I'm socially distanced. But I'm sorry you feel that way. I do care about the community. I'm not aware of any instance where anybody has gotten COVID-19 in city council meeting. So I will continue to wear my mask anywhere I go, except when I'm sitting here away from everybody, I take it off so you can hear me. Hopefully, Dave, you heard this.
Any other council comments?
I have a comment. So I just want to make it clear that the opinion expressed by the mayor is not reflective of my opinion as a councilman. I can't speak for the other council members on the council, but I just want to make that clear. It's an opinion that he has expressed, and but it doesn't reflect the opinion from myself.
And yeah, it's funny that you say that, Doc. That's almost exactly what I was going to say is, just as I can't speak for everybody, but for myself, just as I welcome everybody's comments when they call in publicly, I can agree or not agree with what you're saying, but I welcome it, and I think it's positive and it's good for the interaction with the community. It's the same thing for the rest of these council members up here. Every single one of them could say something that I don't agree with or that I do agree with. It's not for me to speak out against them unless it's so egregious. There are those cases, but it was Mr. Bruin's opinion and he expressed it. So that's for him to do. That's all I really had to say. Other than I don't like the virtual nature of us doing this either. I don't like being separated from the public. It's not the way I'd like to do this. But here we are, doing what we can. Thank you.
Thank you, sir. Any other council comments, Solomon?
Yes, Mayor. I just want to say I was at the Rotary meeting this afternoon, the Zoom meeting, and I want to say Mayor Bruin has made an excellent presentation. He touched base on 3 points, and I wish everybody listens to that, where he is focusing or where he wants to go with the city finances and the development aspects of our community. So kudos. Thank you very much for sharing your thoughts with the Rotary.
Thank you, Solomon. I said that was my first time out speaking in public in the new role, and I was very nervous, but very happy with it.
You did a good job. Thank you.
Okay, next on the agenda, I have no council announcements. Next on the agenda is the consent calendar. All items on the consent are considered to be routine and non-controversial by city staff. Consent items may be approved by one motion if no member of the council or audience wishes to comment or ask questions. If comment or discussion is desired by anyone, the item will be removed from the consent agenda and will be considered in listed sequence with an opportunity for any member of the public to address the city council concerning the item before action is taken. I will now read each item. First action and only action on the consent calendar today is the proposed action to approve the draft minutes of the City of Ridgecrest City Council, Successor Redevelopment Agency, Financing Authority, Housing Authority, regular meeting dated January 6, 2021, adjourned and continued on January 7th, 2021. Do any members of the council wish to have an item pulled? Hearing none, do any member of the public wish to have an item pulled? Hearing none, do I have a motion for approval of the consent agenda?
I move approval.
Second?
I have a motion and second. Roll call vote.
Mayor Bruin,
Aye.
Mr. Mauer,
Aye.
Mr. Heyman,
Aye.
Mr. Blades,
Aye.
Mr. Rajaratnam,
Aye.
5 ayes, motion carries.
Fantastic. Next on our item is discussion and action items. We'll begin with action item number 4, which is continued discussion to appoint members to the council committees, boards, and commissions. Ms. Charlin.
Yes, sir. We'll just go ahead and start with your first 3 appointments for the personnel, construction, and handicap. Go ahead and introduce them.
Okay. I have asked 3 close friends, people that I believe are the nature of what we want in terms of honest citizenships. For the Construction Appeals Board, I nominated Jerry Griffin. Jerry is a contractor on base and somebody who I've seen constantly give to this community. For those who don't know him, you might recognize him as the man who sings out in front of Walmart every Christmas as a giving person to the Salvation Army. If he wasn't able to do it this year, but I promise he'll be there again next year because he loves doing that. The second was for the Handicap Access Commission. I nominated Pam Gaton. Pam is the owner and operator of Center for Athletic Success, as well as she has been a long-standing accounting manager for McGee Industries and a well-known person in the community. And finally, for the Personnel Commission, I actually went right to the well and I nominated Dana Griffin, who is my senior vice president at Desert Valleys and manages all of our HR, and I felt was a perfect candidate to be able to bring a balanced approach to any personnel issue.
Thank you, sir. And then I understand Mr. Blades has one as well.
Yes, ma'am. Ryan Smith to Construction Appeals. So I'm still leaving that one spot open with the personnel. Just my fault there, but here we are.
Mr. Heyman.
I do have a person lined up for personnel. I don't know if she's contacted you yet. It was, we had discussed it last night, but she will be getting a hold of you. And
Contacted by anyone. So.
okay, so I do have one person for personnel, and I'll get that into you here, and the other 2 will still be working on.
Okay.
So in the future, Ricka, does that mean we'll have to bring it up on the calendar in the future?
So these are just appointments. They're not actually voted on. So at any point that you guys get these to me and I get a citizen service application, we can go forward with them.
Thank you.
Okay? Okay. Do you have anything, Mr. Mauer? You good? Okay. Then we're good. Mr. Rajaratnam, I believe you're all good. So did you have anything you wanted to say?
No, I'm good. Thank you.
You're welcome.
Great.
Thank you, sir.
Thank you very much. Next item on our agenda is item number 5. This is a discussion to provide guidance to the city's representative on the board of the Indian Wells Valley Groundwater Authority. Mr. Heyman.
Okay, yes, so we will be meeting tomorrow, and what I did is I just kind of took some notes on the agenda items that we'll be discussing at tomorrow's meeting. So I'm going to go over those briefly here, and then I'll be open to any questions or comments from the council. Item number 7 is the recycled water program. And so basically, they'll be looking at the uses for that water. Some of the uses would be landscaping with recycled water, evaluate all beneficial uses of the recycled water to ensure that the recycled water is used for the greatest and most cost-effective benefits to the basin. Priority and beneficial use and reduction of imported water requirements, because that water is considered new water, so it's water that could be used. We want to make sure that it's used for its best beneficial uses and priorities as a whole for the basin. Some of the areas that we're looking at would be landscape irrigation, surface spreading, deep injection, and direct use of the water, such as with Searles Valley Minerals or the Water District. The analysis will serve as a guideline for initiating design and working with the city's work on new wastewater treatment plant. And so that's kind of that one in a nutshell. Item 8 is new meeting dates. So as it looks right now, we're looking at changing the Groundwater Authority meetings from the 3rd Thursday to the 2nd Wednesday. At least that's the date that's looking the most likely. So that will be discussed tomorrow, and hopefully we'll firm up that date so everybody can plan around it. Item 9 is the budget pro forma. So the budget that was on the agenda last month or last meeting was moved to this upcoming meeting. So we'll be going over the budget and the budget pro forma. Let's see here. So next agenda item is the Brown, what is it?
That's just the financial audit from
Yeah.
2018, 2019. It's a report from our
Brown Armstrong is.
from Brown Armstrong. We're just reporting the financial audit of the GA for 2 years.
Okay. And then the following one is Capital Corps. Capital Corps, we will be giving a presentation tomorrow. Some of the highlights of it will be to identify and procure imported water supply, develop and secure transfer partners, identify and secure funding sources. Some of the recommendations that they're going to be looking at are re-engagement with water districts and agencies for private water and private water owners, state agencies to determine current availability of water. They'll also be looking at and recommending it to include potential financing alternatives for the water supply within the scope of their work, and also continue with minimal updates and briefings with the LA DWP and AVEC as situations arrive, and basically in decisions regarding the routing of the project. So, and a little more on Capital Corps. Well, that's actually just some notes from the prior. And then we'll also be looking at the, with Capital Corps, the contract extension. So at the end of the presentation, we'll be looking at extending their contract. And then item 13 is board considerations and possible approval of variances requested by China Lake Acres Mutual Water Company and Northeast Leelighter Water Co-op. And so basically these two water mutuals are applying for a variance due to financial hardship. So we'll be listening to that and making a decision on that variance. And then last and not least is the transient pool. So there'll be discussions on the transient pool and updates to it, and basically pertaining to some of the highlights are in the pool itself, can ag transfer that water right? Can they transfer it with their land if they were to sell the land? And also a brief overview of the waiving of the legal challenges that they could bring, and so kind of pinpointing it and making a little tighter parameter, or not tighter parameters, but a how can I say it? Basically allowing the ag a time frame that they could enter into the transit pool and waive that right, but they would have time, a set amount of time that they could opt out of it if they wanted. So it's a little more leniency and a little more understoodness of the transit pool. So I'm open to any comments from the council.
I'll let Mr. Maurer begin.
Yeah, I'm sure I'm not alone in this. I've gotten several emails, and I think it's a concerted effort. They're all the same email signed by different people requesting that the agency postpone the infliction of the fees. And I noticed the Water District asked for that also. Is there any consideration of even looking at that? And I don't know what kind of financial impact that would have. I imagine it would be pretty substantial.
So
I can say that, yes, we did receive letters. There will be a request that I believe will be made by the Water District during the meeting for that maybe to be agendized for the February 10th meeting. But keep in mind that representatives of the Groundwater Authority have been meeting with Cyrils and have made a generous offer to them that they have turned down that would significantly reduce the amount of money that they would have to pay towards a replenishment fee. So this is an ongoing litigation issue with Cyrils. There are several items that are going to be funded by the replenishment fee, and if the replenishment fee is put on hold, all those projects will be put on hold. Basically what the Water District and Cyrils and a couple other entities are asking is that the replenishment fee be put on hold until such time as the GSP is approved by DWR. To do so would put everything on hold for 12 to 24 months. So right now, there can be a consideration in the future on what may happen with the replenishment fee. Can it be reduced? But there are some legal issues that come with that that can be addressed by the lawyers with Cyril's. But I can say that the Groundwater Authority has made an effort to work with Cyril's and provide Cyril's an offer that would significantly reduce what their payment would be, and they have not participated in those negotiations.
Mr. Blades?
I had a long list of questions, and you kind of went over them, Doc, as you were going. I guess let's touch on, and then we're lucky that you're now the chair, and then we got the city manager right here. Can we touch on the budget real quick? So I didn't know last meeting. I didn't watch the last meeting, you guys. I didn't know if you dug into it or whatnot in the meeting. You just said you didn't. It's going to be presented at this meeting. You're going to go through it with a fine-tooth comb, kind of like we do in the city council and go over the city budget. As I understand it, that's going to be the case. And then you're going to be able to present.
Well, actually, Mr. Staheli from the Water District will be presenting the performa. But what I can say is the performa now is balanced. In other words, all of the activities that are where they have expenditures have a revenue source that attached. And those revenue sources could either be grant revenue or the extraction fee, pumping fee, or the replenishment fee. Right now we've taken the rudimentary course of just on the administration of the Groundwater Authority, just split that revenue into that account, 50% from extraction and 50% from replenishment fee, knowing that as we move forward that all those expenditures are going to need to be accounted to the appropriate revenue source. We are working to bring a independent firm on board that can provide administration and management services to the Groundwater Authority. That direction was given to staff on December 17th. The staff managers as well as the attorneys have been working with this firm. We've received a proposal, and as part of that, they will take over the management of the finances of the Groundwater Authority. My recommendation, based upon our financial audit and as well as just looking at the performa, is to eventually move this performa into what we would normally see in the municipal world as, somewhat of a line item project-based budget, where we have some software that addresses, revenue and expenditures in quite a bit more detail. So it's a little bit easier to track. I will say this performa is much clearer than in the past. It does state, for instance, there's an expenditure on there for the capital core contract for 2021. Mm-hmm. And it lists an amount of $175,000, and the revenue source for that's going to be the replenishment fee. So it's a lot clearer of where the finances are going. One of the safety factors of almost all the expenditures of the Groundwater Authority, everything is brought to the board for approval before the expenditure is made. So there is quite a bit of oversight on this. But I do believe that as we move forward with a secure source of revenue and we keep track of our expenditures through a little bit more advanced reporting method, I think things will be a little bit clearer. You'll always have those out there that really don't want to spend what we need to spend to get through this, and that's an issue for the board to address in their approval of the budget and specifically the approval of projects. So,
sure. And the transient pool, you touched on it for quick. That's an agenda item, the transient pool. I thought that was the way the transient pool was set up and the GSP that was all kind of concrete. And I'm understanding if that's on the agenda, that is no longer a concrete. We're a little more. No pun intended. It's fluid now.
No, this would be to add some changes to the transient pool as it previously was set up. So it clarifies some of the questions that those involved in the transient pool have had. they brought to the board, and so they've addressed it, and that's what they'll be looking at in the transient pool.
Yeah, part of the issue with the transient pool is the stuttering start of the fallowing program. In the agenda packet, there's a letter to the farmers from the GA kind of explaining, what happened with the fallowing program and why it's kind of come to a stuttering start. So in response to that, obviously it did put a little bit of a little impact on the transient pool, because all along the thought was that the people who had a transient pool right could then sell that right and basically be bought out. But part of that process was the fallowing program. But since it really hasn't come to fruition, the staff and the attorneys are coming up with another method of maybe offering interfund purchases between the transient pool parties, or purchasing of that transient pool right. And so that's being worked out now. So yes, so you're just seeing a minor adjustment to that, accounting for some of these discussions.
Okay. So I'll just keep going through my list if you got the patience.
You keep going.
Okay. The other one is at number 16, board consideration and approval for tech support services. What is tech support service? Sorry, I didn't go all the way through the packet.
So, pertaining to the well drilling in the southwest area of the El Pasos, so that one I meant to bring that up earlier when I was going over some of the agenda items, but so that's in process. So they are slated to be, I believe, drilling on January 25th. Is that I believe the time frame that is set. So, and basically, we're going to be drilling a borehole with 3 separate drill pipes, and at different depths of 500, 1,000, 1,500 feet, and be monitoring a variety of data that's going to come out of that, from water quality and TDSs and
recharge rates,
recharge rate, quantity, and I think even soil sample, or soil data, and but that's all in progress. And
so was that a slowdown with the contractor, or maybe funding? I think we were.
I believe it was funding way back, or back when I first started. Yeah, we were
briefed last fall. Well, I think we were briefed that it was going to be in the fall, October frame. We're going to do that Southwest testing, and that must have kept getting pushed to the right.
If I remember right, when I first came on board, there was discussion of it, but then there was a funding issue, and it got pushed back, to the end of that year, and then the process picked up again.
But this is concrete.
Yes.
Okay.
Yep, most of it's being paid for through a grant with a small match from the Groundwater Authority.
Sure. Okay. And I'll go back to something that we've all harped on before, but that's all we can do is talk about where we hope the support authorities and the Groundwater Authority is going to go, and that is, so you guys used to do, at least Mick had on, a future of the Groundwater Authority and where we think things are going to go. Mm-hmm. And I know that in the GSP, there are times where they do note there's data gaps. Everybody's agreed that. You guys, everybody I've ever talked to said there's data gaps. Is there still a plan? I know you guys are just going to get off the ground with funding. Is there still a plan to fill some of those data gaps? Not just with this testing in the Southwest, but there's also testing in the, in the Sierras themselves to see how, things are fed back into the, to the recharge rate. I mean, there was a list of things in the GSP on to fill those data gaps, is what in summary. And since you're the chair now, you're the manager, I didn't know if you guys are thinking along those lines on how we're going to do that, because we know what our numbers are, but we also see the range of numbers.
Right.
I'm not saying anything you guys haven't heard before. I'm bringing it up for the public because the public needs to hear these things.
Well, I think one of the efforts they have to fill the data gap, obviously, is the test well in the Southwest area. And also it's important to continue to move forward on several of these projects, like the recycled water project, because that's actually bringing new water to the table, which requires less of importation requirement. I do believe that there are other staff reports that, I don't know, I'd have to get back to you on the specific, what actually is the plan to fill some of these data gaps, because I think, some of that's just going to come as naturally as let's say, as the farmers quit pumping, you'll get some of that data. But actually, some of that specific, I'm not prepared to answer that at this point.
Sure, and I'm not trying to put your feet to the fire like I would like to see an Excel spreadsheet that we're going to do X, Y, Z. I just want to make sure that we're talking about it, and I'll just keep on talking about it as long as I'm on the council. I think it's important that we're saying, yes, taxpayer, we want you to spend this amount of money so we can fix this problem, which is exactly what the GA is doing. That's a good thing, but we're also making sure that we know exactly what we're doing. If that makes sense.
Yeah.
Okay. Thanks, Doc. Thanks.
That's it.
For now.
Solomon, any questions?
No, sir. I couldn't hear much of the conversation, so I don't want to misspeak anything, so I apologize.
Okay, sir. Apologize for that.
Can you not hear me very well, Solomon?
Yeah, I missed most of the conversation, so I don't know if Mr. Lloyd was able to hear, but that's okay.
I think we had a brief computer snafu during the course of the conversation.
We did, but also when you turn your head sideways back and forth, the discussion goes away from the mic. You have to talk into the mic. So I think that's where he's saying maybe he couldn't hear you because you were looking back and forth between the two.
I need to sit here like a robot.
Or just get it closer so that when you look back. Yeah. I would think
that's
that
why
was
I've been trying to do
fine.
this.
Yeah. Okay.
Rather than turning it back on and
I
off.
just need to hold this thing like a rock star.
There you go.
Okay.
Yeah.
This is Lloyd. This is Lloyd, if I may, Mr. Mayor.
Yes, sir.
I texted Rick. I can hear the mayor and Councilmember Rajaratnam and Ron. Everyone else is very, very faint, but I've got the YouTube on, so I'm hearing on delay as well.
So we all need to speak a little more clearly and into the microphone.
Correct.
Okay. Doc, I have no questions. I think that obviously the water issue is going to continue to be a challenge. I thank you for your service to the GA. I don't think there's, as I spoke to Rotary today, I said, water is one of those issues that we've had a problem for 60 years. We're going to have a problem for 20 more years, and no solution is going to satisfy anyone. I appreciate your guys' continued work. I, too, picked up a replenishment fee on my bill. I personally paid it with a smile because I think that that's part of the future needs for this community, and I know there's other people out there doing the ballyhoo in regards to the costs, and I think that the fact is that this is a direction that we need to go to protect the future of this basin as well as get the GA on the direction we need to go. So thank you and appreciate it, Doc.
You bet.
Yeah, thanks, Doc.
Okay, next item on the agenda is item number 6. This is a resolution of the Ridgecrest City Council approving the application for the statewide park development and community revitalization grant program. Narissa.
Good evening, Mr. Mayor and Council. Next slide, please. So we're here tonight to ask Council to approve the filing of the application for the
real
Ridgecrest
quick,
Community
Marissa?
Pool.
We're going to see if we can make you louder.
Get closer.
No, I mean, I think you're good. We just need to master technology.
You need to mark which dice.
What number you are. Checking the mic. Check the mic. There's a lectern that must count this.
Testing.
There you
Yep, you're good.
We're here tonight to ask Council to approve the filing of an application for the Ridgecrest Community Pool. As stated on the resolution, this includes funding for 30 years to operate and maintain the project. I wanted to cover a few important details regarding the 30-year commitment. If we are not able to uphold that 30-year commitment, we may have to repay the grant. There's a few different options, or you sell the land and give them a certain portion of whatever it's worth. So in approving this resolution, we definitely want to keep that in mind. This is a competitive grant, so we are going against other cities. Also, staff's going to continue holding public meetings to cover the design. Staff will update council in the first meeting in March as to what the community and staff have decided as far as the design goes. Next slide, please. Grant key points, we can get up to $8.5 million for the project. The application deadline had been extended to March 14th. Notice of approximate awardance is 5 months after the application is received. As I said a little bit ago, it is a competitive grant. In the previous round, there were 478 applications submitted, 62 projects were awarded. When the application is submitted, the design that we submit is what we have to build. Projects must be in a severely disadvantaged area and require to maintain the facility for 30 years, and we are required to have community involvement. Next slide. During this process of the grant, we have held 6 community-based meetings to get ideas for a project was number 1. The pool was what the community voted most on. Public input for design, discussed location, input for art and beautification, and safety. Our upcoming quality of life meeting on February 2nd, we will be talking about the design and layout, and then we will update council on design and layouts chosen. Next slide. Site features, we are looking to have a competition pool, 25-yard by 25-meter, a kiddie pool for swim lessons, shade, lighting, cameras, a snack bar with restrooms, showers, and a multi-purpose building. In the multi-purpose building, we're hoping to be able to rent out for parties and different events and meetings even. Next slide. Project locations considered, the current Penny Pool and Freedom Park. We chose the Penny Pool location based on the infrastructure already being there, and we were also able to get points based on the acreage and size that we can have there. Freedom Park, we're not able to meet the acreage. Next slide. In this slide, you will see one of the design options and also a sample of the layout that's been discussed in the quality of life meetings. So the big gray area next to Warner Street would be the parking lot, as well as the side parking lot still existing. You'll see the buildings and then the 2 separate pool options. And this also breaks down the cost of building that pool. Next slide. In this one, you will see the option number 2, and this is to have a single pool with this pool being pushed back, same kind of layout and format. The only difference is it's a single pool. And this also shows the breakdown for how much the cost is to build the pool. Next slide. This is the estimated yearly expense cost for option 1 and 2. So this is what it will cost to maintain the pool for 10 weeks of operation. We would operate the pool based as seasonal, which is allowed by the qualifications for the grant because pools are considered seasonal. We would be able to lease out or rent the facility to the schools or swim groups during the off-season. Next slide. You'll see the estimated revenue is $100,000 yearly. The city would have to subsidize an estimated $250,000 a year. And I listed the sources of revenue that we've come up with now, but we're hoping to come up with other activities to generate more revenue. Is there any questions?
I'm going to let the council begin. I'll start with Solomon on the online this time.
Ms. Wagner already answered my questions. I clarified offline, so I don't have any questions on this, and I think she has done a great job, and hopefully we'll be able to get this grant. I think this is a much needed requirement for our community, so I don't know what else we can do to make sure we get this grant, but I'm in full support of this proposal.
Okay, let's go Mr. Maurer.
Yes, in your presentation in print, it mentions 8 million, but you said we can go up to 8.5. Is there a reason why we're going 8 instead of 8.5?
The pool is up to 8.5. We have to leave a gap in there for incidental costs. So like if there's something that comes up during the project.
Okay. And then I guess it doesn't need to, the resolution itself does not say the amount. I don't know if that needs to.
So the resolution that we had to use was from OGALS. Those are they create their resolution, and we have to have that. That's the required one for the application.
Okay.
Mr. Blades.
I have a few comments, but I think I heard a phone call. I don't know if we want to go to them first or.
I was going to let the council make a couple comments, and I was going to allow the public to comment.
Okay, so the intent was, and you answered that part of my question, to keep the pool seasonal, right? So that keeps the, and your cost, your estimated cost is just with it being seasonal.
Correct.
So does that mean if you run out to other, whoever it be, in the off-season, does that operation cost go up regardless? I mean, they're going to pay a fee, but I mean.
So when they build in the cost, it's obviously factoring in the chlorine and things like that throughout the year because of that. So for additional costs, such as lighting and things like that that we would be using in the off-season, we can build into, like we do for the Carnegie Youth Sports Complex, we charge them for the light usage when they're at that facility. So that's something that we could do to recuperate those costs.
Okay, now I haven't been at the quality of life meetings. Was there ever a discuss of a therapy pool with the hospital?
So the therapy pool was in there, but due to obviously having a certain budget for the project, there were certain things that weren't put in.
Thank you. Yeah, very good job. You guys have been doing an excellent job.
Thank you.
This, and I appreciate it. I guess I have more of a comment, and this is to, I guess, the council and then also as well to the public. I'm seeing the costs, and I've looked at the budget for two years now. I don't see that extra money to subsidize in our budget. So I'm just going to say that with an exclamation point. I hope that the public's paying attention to that. I just don't see the money there, so we will have to address that. That's an open-ended statement, but I hope everybody's paying attention. This isn't just going to be something that comes in and comes out. Yes, we all want it. Yes, we'd like to see it. Yes, it'd be a good thing for the community. We have to decide as a community if we're going to invest in this community or are we going to let it pass us by.
Correct.
Sorry, I'm off.
I am in full agreement with you. I'll let Mr. Amon.
Well, yeah, that's our primary concern is can we afford it? And under the sources of revenue, we have open swim, lap swim, swim lessons, concession rentals, water aerobics, water Zumba, other activities. Are there any other primary uses of the pool? I guess I can answer that.
It would be like our rentals, which would fall under like the school district using it if they wanted to use it for their swim team or IWV swim, things like that.
Right, that's what I was alluding to. And is that included in this sources of revenue?
Yes.
Under what?
So we went ahead and we went back and looked at the previous revenue and fees that we were charging previously, and we used I forgot what it's called, but the city uses it to determine how much the rates should increase by.
Usually the cost of living or overhead.
Yeah, like the CPI, I think.
Yeah, cost of living index, yeah.
So we use that to determine what we should raise our fees to. So obviously I don't have like a fee schedule because that needs to be approved on other levels first, but we based it off of those fees.
Okay, and so then under the amount, where did I read it under, the $100,000, amount, is that including the?
That includes open swim, swim lessons, concessions, rentals, everything.
And the swim team?
Yes.
Okay, so that $200,000 would be the out-of-pocket.
Correct.
Pretty firmly. So back on the overall cost of the project, what was the total on that slide? I got just a glimpse of it, and
for the building of the pool?
yeah,
7.7.
I thought I read a 9 at the.
So at the
the
bottom,
COVID factor at the bottom.
yeah, they add in the COVID factor, but that's not. The COVID factor is not a set thing. They just kind of do that based on the fact that right now, where we're at with COVID, sometimes supplies are hard to gain, but we're not going to start the project for a while, so hopefully that won't be an issue.
Okay, because that
Yes.
budget gap there, or project gap
Right.
would be pretty impacted to the
Right.
ability for us to even consider it. So, any thoughts on that, Mayor?
Well, again, we know there's two problems, and these are distinct problems that we know going into this conversation. That's first, that we haven't received the grant. So any conversation about the expense side is not finalized until we actually have a grant and a pool to build. The second is that we have a revenue problem. And those two are offsetting, and they're going to both have to be solved prior to accepting the grant award. So my biggest thing is that right now we are looking for the commitment of this council to moving forward. That's the one reason why I brought it to the agenda today. And then we have, while this 5-month process is going on, we are going to have discussions and be prepared to make decisions in terms of how we're going to solve that revenue challenge if we cross the first hurdle, which is receiving the grant. I'm going to go ahead and keep your fingers away. Trying not to breathe into everyone else's conversations. Okay, so I'm going to go ahead and take questions from the public at this stage, and I believe we have some. Okay, caller, state your name.
Mike Stafford, IWV football president.
Thank you, sir. Go ahead. Right ahead.
Okay, so I'd like to offer a backstory for the new members. Back in 2019, the clubs were assessed a reservation fee. It started at $100 a week, and then it was increased to $200, and then it's supposed to top out at $300 a week. This came about due to the parks, the tax that didn't pass back in 2019 as well. The clubs were called in and told that the money had to come from somewhere, so a status quo would not support the fields we have. The clubs would be assessed this fee. My question is, what is bettered in the financial situation to be able to double our expenses? I understand what you're saying as far as applying for it, and through the process there'll still be more discussions, and ultimately we have to accept it. But this to me is a terrifying investment. If just 2 years ago we were told that we cannot maintain what we have already, and then to almost double our fees, it just seems extremely risky.
Agreed. Thank you for your comment.
I'll let you respond. Thanks. Next caller.
Next caller. Maybe I can help you out there.
Next caller. No more callers. Okay. Let me just go ahead and quickly respond. I agree with you that it would be problematic, and that's the key, is that we understand, and I encourage our council to consider that approving this today is approving going forward with the application for the grant. It is not your final approval to build the pool. It is that we know we have a revenue problem to solve, but we need to give the staff the direction that this council is supportive of this general direction and going forward with the grant. And we have 5 months, 6 months to solve the problem and to be able to present to this council and to this community the solution for how we're going to solve that problem.
Absolutely. And I'm in agreement. I just wanted to underscore for the public that we're putting that conversation onto them.
Yes,
right.
This conversation is
here
going to
now.
be on the
No
community.
more playing with it. It's here.
Yep. If you're the community, to be clear, if the community wants a community pool, the community is going to have to stand up in favor of that community pool and help us find the revenue to make that happen. I'm in full agreement with Mr. Blades. I do believe we have one more caller. I'm going to give it the opportunity since there was a time delay. Caller, state your name.
Jennifer Williams.
Please go ahead, Ms. Williams.
Oh, hold on. I'm going to just turn off the computer here. So go ahead and speak right now. Sorry.
Yes, ma'am.
Yes, my name's Jennifer Williams. I'm a public school teacher with Sierra Sands nearly 30 years, and then we also coach the swim team for over 10 years in town. And I just wanted to say that we really are hoping that the city will pursue this opportunity in many ways. One, of course, is just our youth in our town. So I work with many at-risk students. Having us, it's more than it's more than just unless it's having a aquatic facility year round, or if it at the very least 10 months. But we really need something for kids to do. And I think as far as the risk, it's really only an investment in our youth in town and in the quality of life in town, in our houses, you know, the community, everything. It just is just going to add value to everything that our town has to offer. Versus now, you know, there's nothing that really kids can do. So I just was really just want to express my support, and I would disagree that it's not a risk. It's only really an investment in our community. So thank you.
Thank you, ma'am. Any other council comments? Do I have a motion to approve the resolution?
So moved.
I make a motion to approve the resolution.
I have a motion and a second. Roll call.
Mayor Bruin.
Aye.
Mr. Mauer.
Aye.
Mr. Heyman.
Aye.
Mr. Blades.
Aye.
Mr. Rajaratnam.
Aye.
5 ayes, motion carries.
Okay, next item is the public hearing. Public hearing is in resolution approving the fiscal year 2021-2022 annual application regarding the Kern County Community Development Block Grant, the CDBG program. This is being presented by Ms. Charlon and Ms. Wagner. You're presenting the nurse, right?
She's opening, and then I will take over.
Okay, come on, tag teams.
Okay, so tonight we're going to have a public hearing for the Community Development Block Grant funding for FY 21-22. The anticipated fair share amount is $107,111, and just need you to understand it's anticipated. That's not set in stone. So as we go forward talking about combining these grants and whatnot, we have to understand that this is what we hope to get. Next slide, please. So the grant qualifications are you must be in a disadvantaged area, and eligible projects are the 6 that are listed up there, which is recreational improvements, public facility rehab, ADA improvements, public facility improvements, water sewer improvements, street drainage improvements, or architectural barriers. And if you go to the next slide, you can see what I meant by disadvantaged areas. Mr. Heimsoth, thank you, sir. So we have 2 areas in town that qualify for the disadvantaged areas. One of them is the Leroy Jackson Sports Complex area. The other one is the Freedom Park Penny Pool area. Next slide, please. So tonight we're here for the public hearing to receive input from the community on potential qualifying projects to be considered by the council for this grant for FY 21-22. First, staff would like to begin with the public hearing with a presentation of our recommended project, and then we also need to open it up to the public to see if they have any recommendations. So at this time, I'm going to let Narissa go forward because we have chosen to go forward with a Parks and Rec project, and she's going to present that.
Thank you, ma'am.
Mm-hmm. So the staff's recommendation is to improve the softball fields out at the Leroy Jackson Sports Complex. The 2 lower fields are used primarily by our schools and private leagues. The recommended improvements that we have are the infield upgrade, leveling of the field, or the infield, and adding, that would be adding clay dirt mixture and edging the infields, making them look a lot nicer. We would like to add covered dugouts to provide shade for our players and covered spectator seating area. Next slide. The project cost, I have met with a local contractor to get an estimated cost, again, estimated based on what he saw. We're not completely into the project. The initial estimate of $142,500 per field. This includes labor and materials and prevailing wage for the project. Total project cost will be $285,000. Staff is also researching the possibility of using a pre-negotiated purchasing contract for the project. This is something that we used when we put the splash pad, when we added the new play equipment to the parks. We also used it for the restroom out in Freedom Park as well. I've been working with the companies on kind of looking into estimates going that route as well. Staff recommends combining the per capita grant, which is the grant that we've already been awarded for the amount of $178,000, and the CDBG grant if we're awarded the $107,000 in order to complete this project. Next slide. Project benefits: provides better playing fields, provides shade to players and spectators. Combining the grants would allow the city to do a larger, more beneficial project. Next slide. This project is supported by the IWV Youth Softball Group, Burroughs High School softball team, and the City of Ridgecrest Quality of Life Committee. I personally spoke with the softball group and the Burroughs athletic director to get ideas for things that they felt were beneficial and needs, and that's where I came up with the shaded areas, fixing our infields. And in these pictures, you can see, you know, how bad our infields look. You can see some of how the outfields look, which maintenance is already starting to work on the outfields by seeding and filling in holes. You can see that we don't have shade. This last slide shows an example of the types of shade structures that we can put in. Any questions?
So we'll go ahead and start with any public comment. And we have to open the public. Isn't the public hearing open? Or first have to open it?
Officially, if you could open
I got a quick question while we're waiting for the public. Is this the first of 2 hearings, Rika?
No, sir, this is the only one.
This is the only hearing?
Correct. It was publicly noticed in the newspaper, and this is the only one for the project.
Thank you.
Mm-hmm.
Okay, we will go ahead and open the public hearing. And any public comment? I'm hearing none.
Okay,
There it
there it
is.
goes. That delay gets us every time.
Caller, state your name.
I'm Mike Stafford.
Once again, caller, state your name.
It's Mike Stafford.
Please proceed, sir.
Once again, Mike Stafford out of WV Football. My recommendation is whatever project we do regarding fields and grass involves some sort of windbreak. That's what's really destroying these fields is our wind, and it's blowing our water away, it's blowing our seed away. It just seems the old football fields over there, the Kerr-McGee fields, seem to do best because it's kind of a recessed field, and plus it has the windbreak from the fences, and also the Freedom Park as well is a well blocked by trees and surrounded buildings, and just something to look at when doing these upgrades.
Thank you, sir. Any other public comment?
Think about that.
Hearing none. Rick, I don't have instruction. Do I have to close public comment before we take council comment?
No, keep it open until we're
Okay,
completely
it will
done,
stay
please.
open. Any council comments? I'll go ahead and start with Solomon.
No, Mayor, I don't have any comments. Thank you.
Okay, Mr. Maurer?
Yes, in looking at the pictures you showed of the possible covers, some of them were metal, some of them were cloth. Is that true?
Right, yes.
I think,
go ahead, sorry.
I was going to say, I think the metal ones would be better. I've seen a lot of destruction of cloth because the winds can kick up and tear those pretty quickly. So I would recommend that if we do this, that we do it with something permanently. I have a mobile home down at the Colorado River, and we have lost at least one easy up a year down there from the winds tearing those up, and we have had covered patio, and we lose those every year too. So the winds can be very erratic, and I think that we're best off spinning on metal rather than the cloth.
Yes, sir.
Other than that, I'm in favor of the project.
Mr. Blades?
You would know, Parks and Rec Department would know better than I would about what gets more use. Is it those fields that, the Roy Jackson fields, or the soccer fields? They're a little bit ways away.
I think it's pretty equal, honestly.
Mm-hmm. And the only improvement I would say, I mean, I'm sure people are going to disagree with me, but those soccer fields probably need to be improved as well. they're pretty tore up, right? I notice that when kids are trying to run through them, they're stepping in pretty big holes. Some of it's nice grass, but it's usually just mud.
Right.
So I don't know if that could be a part of the grant, or if you have to allocate the grant just to one specific area.
It really just depends on the cost and keeping it within the amount of what we would have in the budget for the grants combined together.
Sure. So if it does all go through, you get both the grants, it's really going to be kind of up to you, the Parks Department, and you, Ron, for your discretion, right?
I think essentially we have taken it to the quality of life to get the shades and things like that approved as the project. So I think that at this point we would move forward in that direction. Mr. Strand has mentioned about the Parks and Rec Department being able to apply for future CDBG grants. So I think that with that in mind, we may be able to add more upgrades to the other portion of that complex.
Yeah, I think staff's position at this point in time would be to use the future CBDG funds for park improvements. So we'd have, let's say approximately $100,000 a year that we could put towards some sort of repair or capital project at our facilities. Will obviously help quite a bit. And I know that our maintenance folks are working to level those fields out. We do have a piece of equipment that we use for that replaces the dirt and levels the fields out to get rid of those ankle turners. So we are working on that. It's just a lot of it has to do with just staff and timing.
Sure. Yeah, I know your staff's spread pretty thin. That's something I ask you all the time, and I already know the answer, but
right.
I appreciate it.
To be frank with you, from a staff's perspective, we'd like to be much more aggressive in improving and enhancing our park facilities. I think it's very important. So I think that as we move forward in the up and coming years, we need to try and find a way of, maybe making this process go a little bit quicker, because we are picking winners and losers. We had, baseball one year with refurbishment of the Kerr-McGee ball fields. Now we're going to be working with girls softball and maybe even the adult softball league to repair those fields. But it's almost like a whack-a-mole. As we repair them, as time goes by, they become in disrepair. So we really need to work. Give me some bad feedback here. We really need to work as much as we possibly can to really do a good job and end up keeping our fields and improving them.
Sure. And I'll even throw I don't know how it's going to work in the future, I'll even throw the skate park in there. Getting that place shade would be huge.
Okay.
Councilman, actually, I'm going to go ahead and I believe we have a call that came in, so I'm going to go ahead and let the call go ahead and before you. Is that okay, Mr. Ream? Okay.
I already know the answer, but...
Caller, state your name.
Oh, yeah, hi, it's Dave Matthews. There's a problem in that area over there that has been discussed all the way back to Bill Bursey. And if you don't know who Bill Bursey was, go look up the city history. He was the first Parks and Rec director, I think. But there's a lighting problem with the lights in the field. They are both a safety hazard to people coming across lost floors, and as well as maybe a few other streets, and also with the China Lake Astronomical Society doing their viewing from some of their stuff. Now, they haven't been meeting this past year because of the current situation. But I think that needs to be addressed here pretty darn soon.
So to understand, Mr. Matthews, you're speaking of the lighting at the Kerr-McGee fields as a recommended item to be looked at in the future?
He's turned his radio. That's okay. We know when I'm coming up with the delay. There's a long delay.
Okay. Thank you, sir. Any other comments?
That's it.
Okay. Thank you, sir. Councilman Heyman.
Yes, I just want to add that I think the staff has done a great job in prioritizing the needs and the directing of these funds for this project. I'm in favor of it. We live in the desert. I think I might have mentioned that last time. It's really hot, and we've got ball players and spectators sitting out in the direct sun. So I think it's nice to see this money used towards maintenance of existing parks or fields that we have, and the usage of it, providing shade and over the dugouts and the bleachers, I think is a great thing. And Mike, we had discussed in parks, about those shades, and you're exactly right about going with something that is going to be longer lasting. And we talked a little bit too about positioning, to try to maximize about the height, and getting maximum shade out of the structure too, to maximize the benefit of it. But
the advantage of being in the sunlight is you get vitamin D.
well,
maybe too much.
Except for you absorb it less, right, in your age, right, Mike?
Yeah, the older I get, the less I absorb. Thank you. Thanks for pointing that out. I think I absorb 1/3 the amount of a teenager out in the same amount of sunlight.
That's all I have to add to it. I think you guys have done a great job.
Thank you.
Thank you, Councilman. Once again, I want to commend the staff on what looks like a great solution to taking multiple things to solve one need, which is taking the 2 grants and finding the best solution for the community. I think that, once again, anything that improves the quality of life for our youth is a good thing. I think getting them out of the sun is a good thing. And this also leans towards, adult softball leagues and again, creating more value for adult recreation, for traveling teams opportunities. Anything we can do to improve those opportunities is good for this community and good for bringing people in. I commend you on the project idea, and I thank the public for throwing in a few other ideas for us to look at. It certainly sounds like our Parks and Recs department could use lots of revenue support, and I certainly hope that we can find a revenue solution that can work towards all of the goals that we've talked about today. With that in mind, I'm going to go ahead and close the public hearing. And do I have a motion for the recommendation as presented?
So move.
Do I have a second?
Second.
I have a second. Roll call vote.
Mayor Bruin.
Aye.
Mr. Maurer.
Aye.
Mr. Heyman.
Aye.
Mr. Blades.
Aye.
Mr. Rajaratnam.
Aye.
5 ayes, motion carries.
Great. Next on our agenda is committee reports. Thank you, Narissa. First committee up is Finance Committee. Finance Committee has not met. We were scheduled for the 18th. That was a holiday. We have rescheduled for the 25th at 5:30 p.m. That is next Monday. Infrastructure, Mr. Nauer, Ms. Blades.
Meeting a week from tomorrow at 5 o'clock.
Fantastic. Economic Development.
So we did meet, and the key item from that meeting was going over the Buxton analytics. I think everybody knows what Buxton is. If you want, I could go back over Buxton and what it's meant for the city. It was an investment on behalf of the city and a few other stakeholders. The software was used to hopefully bring in more business. And long story short, stakeholders as well as the city staff recommendation was to in the contract as it was ending, and so that's where we are. We chose it in that contract, and our recommendation as well within that meeting was to say, hey, Buxton, if you want to come back at city staff with either a different pricing structure or different ideas on how to use your software, since we don't believe we got what we were paying for, then please do so. But at this time, we were going to part ways and go on about our business.
Anything to add?
Solomon was in there as well.
Keep
Solomon
your fingers away from that.
The main reason why we decided not to go with that is at this time we are not able to get the benefit of credit card sales. So that's the main reason we went with Buxton. They promised us the credit card data, which we thought we can use to see how best it can be used to attract businesses, but we were not able to get that benefit. So that's one of the main reasons why we decided to terminate the contract at this time.
Thank you, guys. Next is Parks and Rec, Quality of Life. Obviously, we put forth the recommendation. We spoke about it last meeting. Our next meeting is on February 2nd, and I think we have scheduled 2 meetings in the course of February to allow for the public to continue to provide us insight and dialogue. The public got a chance to see the kind of the proposed pool designs. I encourage council members, if you have any information or ideas on your opinions of those 2 different designs, to share them with the committee, as well as to get the public input on the committee's direction, especially in design and finalizing, because what we submit is what we have to build. That is one of the things that we definitely have spent some time asking the question about. And so we want to make sure that what we submit is what we are expecting. Next is RACVB. Melissa? I don't see her, so I will ask if, Ron, you have anything?
No, there is nothing to report, but I do believe that the RACVB will be coming forward with a report to council here in the near future.
Okay, thank you. Other committees, boards, or commissions?
Yes. I have Kern Cog tomorrow. Kyle is my alternate. If you want to call in there, you'd actually be a public. You wouldn't. So when they do roll call, they won't call your name, and you can't vote. But at least you could, since you're brand new on it, you could listen and kind of see how the meeting goes.
Oh, that'd be great. I'll call in. Thank you.
Any others? Oh, there's a man walking towards me, and I didn't notice him.
Wow, I must have lost a lot of weight.
Oh, Bart, I just didn't pay attention.
Lost you in the lights, Bard.
No.
Just got to be easy with it.
So Measure V met the second Monday of January. There were 4 new members, 1 member that had been existing in the past. Discussed, I just heard voices, so. No problem. I just needed to know whether to stop and wait a second. Yeah.
What is this?
Anyway, they elected a chairperson and a vice chair. We discussed all what they are supposed to do, what their charge is basically. They divided up who's going to be on which group: Public Works, Finance, and the Police Department. We should have information to them before the next meeting so that we can start our discussions.
Who's the chair, Bard?
I'm afraid I don't remember. I'm sorry.
John Paul.
Oh, JP. Well, but there's 2, but yes.
Good.
Okay. I don't have any questions. Nope. Thank you, sir. Any other boards and commissions? The only other one I have to report is, I'm pray I don't butcher it, I believe it's the East Kern Economic Development. I had a chance to meet with them and to join in the conversation. We spoke a lot about the man camps and the base reconstruction, as well as some, Melissa took the lead in discussing some of the other economic objectives. Thank you for we're very welcoming and incredible the number of different people that are sharing in that group. So a lot of hopes for the future of Eastern Kern. City manager report.
Yes, Mr. Mayor, members of the council, I have a report tonight. I want to say I'm proud to announce that I'm going to be hiring Chief Jed McLaughlin as the city's new deputy city manager. Several months ago, council had asked me to consider hiring a deputy city manager to help me with several of the assignments that I have. We received a significant number of applications, and Jed was obviously the most qualified applicant that we had. I believe he will do an excellent job assisting me. Some of the areas that he's going to be in charge of initially will be he'll oversee the Parks and Recreation Department, Economic Development, and Planning. He'll also be assigned to oversee the OEA Office of Economic Adjustment grant that we have on water and power resiliency. He will oversee our the implementation or the creation of our organics program that we have to have in place here in the next year and a half. He'll assist me with the fire contract as well as several other things. Now, obviously, he will remain in the chief's position until such time as we can find his replacement. We should be putting an open recruitment out next week. I anticipate it'll take approximately 3 months to hire the new chief, going through the background process, obviously depending upon our quality of applicants that we get. I'm also looking at upgrading the analyst position in Parks and Recreation to a recreation supervisor. This will balance that department out with the deputy city manager being the department head. We'll then have a recreation supervisor and a maintenance supervisor, which should balance those operations quite well. I'm also looking at converting an administrative sergeant position to a captain's position. We've been discussing this for a significant amount of time. I feel it's important that we do this prior to the new chief coming on board, so then we can once again have a balanced police department where we have a captain overseeing operations, patrol, as well as a captain that oversees all of the administration functions. So with this, most all of these moves are budget neutral. In this, we are eliminating or at least not filling the Park and Rec Director position and the analyst in the building department. So we'll be losing about $1,000 worth of work. But I feel by positioning our staff this way, I think it will help us accomplish some of our goals that we're looking at over the next couple of years, because it will help me considerably. We do have some significant projects that we're looking at that I'm directly overseeing. One of them is obviously the Groundwater Authority, while we're still transitioning to another firm to take over administration and management. I will still be intimately involved because we do have Mr. Heyman as the chairman of the board, and obviously, my role is to make sure that he is prepared as he can be for those meetings. So that's what we have at this point in time. We also have interviewed candidates for the Public Works position, with Mr. Lauer retiring effective April 1st to basically be on terminal leave for 4 months. We'll be able to use him during that time for the new Public Works Director. I should have an announcement on that probably within a couple of weeks. So that is my report. I can entertain any questions from the council if you have any.
No questions. You mentioned it's pretty much budget neutral. And I got to say, I'm one of the biggest proponents of an assistant to you. Especially taking on the GA. I know your workload is immense, so I appreciate everything you do, Ron.
Congratulations, Jed. Obviously, I think our department loses somebody great, but our city continues to gain strong succession planning, which is also a very, very critical element to long-term business continuity, as well as new experiences for him. So congratulations.
I guarantee you, though, although this position does not come with a raise, it will come with more work.
I look forward to bothering you more than I already do, Jed.
Any other council comments? Okay. Future agenda items. Any council members with a future item for the agenda?
I have something we could discuss real quick, and you guys decide if you want on the agenda. I've brought it up in the past. I'll bring it up again. Having I think they're termed a retreat, where we have an out-of-cycle meeting where we discuss future of the city, future of the council, where we can openly discuss items on the council. It's something that I think other councils do it. They'll do it a couple times in a year. It just allows us to discuss things without them being. I believe you don't have to agendize every discussion item. I think you post it. You note it, the agenda, the public can be a part, and then we can discuss, as a full council, our thoughts on where the city's going, even entertain things from the staff. Just, hey, this is where we think roads are going, Parks and Direct. We don't have to pour through it line item. Over to you guys. It's something that I've asked for in the past. It's something I hope to see in the future.
Can I comment on that a little bit? I do agree that it would be beneficial to do a planning workshop. Some cities, you'll either have the city manager run it on an informal basis, or you'll actually hire a consulting firm that will come in and run the meeting. I would like to start off where we at least have a planning session to where we can have it on a Friday, Flex Friday, or a weekend where people can come in relaxed. The department heads can come discuss what they feel are the challenges, where we think we should be going, so where we could just have, discussions amongst staff and the council in a way of trying to set some sort of goals, or at least to where the whole council at the same time gets to hear all of the issues, and then maybe not even issues, just where we are doing well and where we think we should go. Obviously, this would have to be open to the public. There's several ways you can do this where the public just observes the meeting and then can have public comment at the end, or have public comment at the beginning and just observe the meeting. There's several ways of doing it. I think there is a benefit to it, because I think even as city manager, it's hard sometimes to be able to, without violating the Brown Act, it's hard to have just a somewhat of a relaxed conversation going, hey, this is where I think we should be going. These are some of our issues. So I think there's a benefit to it. If you wish, we could, maybe set something up in, February or March,
I'm perfectly fine with that. In my perspective, I have no problem working with the city staff and get a date set and agendized. That is a more of a free-form conversation. I personally would probably want to see public comment at the end of it versus in between each of the individual items, in order to allow, Mr. Blaiswell, as you're talking about, for the council to work as a collective through those conversations.
Absolutely.
But at the end, allow for public to provide commentary on what they've heard over the course of that discussion.
Right. And in fairness to the public, we could obviously have another event where we just receive input from the community and discuss it. So it's just not one-sided where the staff's up there talking to the public. Sometimes it's difficult if becomes a debate club during the back and forth between council and department heads. I do believe it's important here for the public, so maybe we plan one for, the city council and department heads, and we plan another event just to hear from the community on what they think their priorities are, so we can balance it out, because I really don't want to, knock the public out, but I also think
I'm perfectly fine with that as well.
Yeah, I also think hearing from your staff without, being interrupted and getting off on a
That's where I was
tangent.
going with it, is keeping it on point versus tangents,
right,
which would come in with a public comment, not to shun the public, but simply to provide us an opportunity to have those direct dialogue conversations until such a point as then we can get input if it's not at the end of that session, but a secondary session that allows for even a 2-week period to pass and allow the public to ingest what came from that session, because we do know that obviously we have a lot of citizens that watch the meeting on a post basis, and certainly that would provide an opportunity for a certain amount of digestion to occur over those issues, and for us all also to be prepared to answer and to respond to things.
Yeah, and to that point, the public, there's a lot of brilliant ideas out there, and they come at me fast enough. I make notes, I try to think of it to bring it up, but this is not the forum, right, for me to say, hey, Mayor, here's an idea on how we design a neighborhood. This is not the forum. So anyways, I want to bring it up. I don't know if putting it on the agenda is necessary. Maybe it's between you and the staff. Maybe I'm just looking for a consensus that it should be something we do in the future, get on the calendar.
Again, I'm fully in support of it. I have no problem with that.
How about let staff come up with a concept? I do think that we need to have a separate meeting so the public can have their input, just so it's not just one-sided. We should be hearing from them also.
Of course.
So let us come up with something. We'll come back to you with it, and then we'll agendize it on a date that's good for everybody, and we'll go from there.
Thank you.
Any other future agenda items? Hearing none, then I will go ahead and close with council comments. Solomon, I'm going to let you be the first since you're on the phone.
I I just want to commend Narissa Wagner for a great job she has done presenting both the items in a very professional way. Good job, Narissa. Thank you.
Mr. Meyer?
I made all my comments at the beginning of the meeting, so I won't make any more.
Mr. Blades?
Yeah, same thing. Thank you for the thank you, Narissa. Thank you, Chief, for presenting the, on short notice, just throwing up statistics like that and conversing with us. I appreciate that. I'd also like to thank the Ridgecrest Regional Hospital for showing up and giving us a presentation, Mr. Suver and Michelle. I also wanted to say thanks to Doc for serving on you're appointed by us, the council, and then you're going, but you're taking a whole lot of heat. It's a heck of a position being on the Groundwater Authority. So I'm saying thank you, and I'm glad it's you, not me.
I concur.
Yeah, I appreciate that. And it's go ahead.
Although I appreciate your comments and your support. There's no doubt that it is it's an important job. I think water is the issue, currently, and one of us, I guess, has to do it.
One of us has to do it, and you take heat from everybody, right? You take heat from the public, from the GA, and you take heat from us as well.
Yeah, and it's a respected heat, and so I appreciate your comments.
Yeah, and the last comment was, there was an inauguration today. Got a new day in our nation. We'll see where we take it. It's up to us to decide our future. So, and I'm sure this community will keep trucking forward like it always has, just getting better.
Thank you, sir. Mr. Hammond?
So I have more of a question. Mr. Lauer, when is your last council meeting that you'll attend? Yeah. Okay, so we got you around for a little bit longer to... Okay. Very good. I have no other comments.
Okay. My only comments are, again, thank you to the staff for another great meeting. Lots of great guidance on several important issues to this community. Thank you to the public who participated and is watching and called in. Thank you for that. I think we took a big step forward with the pool, and I think that we are putting the decision to make this community pool in the hands of our public. We as a council can agree to, as I kind of have stated, get engaged today, but it's you, the public, that are going to allow us to get married to the project by solving the revenue issue. And that's going to take a level of community support on direction over the next couple months as we discuss. I also want to definitely say out there to anyone who is not aware of how difficult the coronavirus has been on families inside of our communities, on business leaders, on all of the people out there in our community. This is a definite challenging period. There's a lot of people that not only have gotten sick, but also it's very tiring in terms of the businesses to maintain their operations and to maintain so many of these challenges. Be nice to your neighbor. Offer them a pat on the back. Know that they're working just as hard as you are to make the best for this community. I've always said that's one of the best things about Ridgecrest is its people, and the people here are working just as hard for themselves as they are for you. And with that, be safe, stay healthy.
Mr. Mayor,
yes.
Can I add one more thing? Sorry to interrupt
Absolutely,
you.
sir.
And maybe you can even expand upon it. I threw it up on social media. I believe in a round of, I think it's PPP loans are coming out. So maybe you can talk to it a lot better than I can.
I will be happy to if I'm asked to.
Sure.
And I'm assuming you are, Kyle. I will be happy to. One of the things that I'm trying to be very careful of is how do you talk about things that are finance related.
Well, when I say at least on social media is I know personally a lot of small businesses that are impacted greatly, especially things like hair salons, the theater, those people. We all know them personally. I know they're hurting, and those loans are out there. I know there's at least 3 banks, Mission, Desert Valleys, and Alta One, that are working to get those grants.
I actually wasn't aware Alta One was, so that's fantastic.
Yep, Alta One, I saw it online. So
that's fantastic.
There's at least 3 banks. I'm not leaving out anybody else on purpose, just so those businesses need to be engaged quickly to get those, they're forgivable loans, not grants.
Yeah, right? So let me go ahead and I'll give a very quick 30,000-foot overview there. The programs that have been reopened is the First Draw PPP program, which is anybody who did not receive a PPP loan during the first round from April to August. If you felt like you missed the opportunity or didn't know about it, The financial institutions can take applications for that application, which does not have a means test. So you don't have to show that your business has suffers a gross receipt decline, and you have to. It doesn't have the same testing requirements as the second draw does. Those loans are available now. I can say I know that I believe Mission is in full force. I know we are in full force. I can tell you, just from a statistical perspective, we have $2.7 million going back into the community by Friday right now through my institution. I don't know about the other ones. That's what we've been able to do to this date. And then the second part, which is the larger part, is the second draw loans. And those are loans for individuals that received a PPP-1 loan, have used the funds in accordance with the guidelines, are still suffering under this pandemic, and are now eligible to apply for a second PPP loan. For restaurateurs or those with the NAIC code 72, they can receive up to 3.5 times their monthly payroll, which is very, very helpful. As well, they don't have to use it specifically for payroll costs. They have to use at least 60% for payroll costs. They can use the other 40% for utilities, rent, supplies, covered overhead. So a lot of other necessary resources that are at challenge. And that is a fully forgivable loan once again. However, this loan does have a means test and an employee cap, which means that it can't be more than 300 employees to the business, as well as the means test requires that they document at least a 25% drop in gross receipts comparative to in 2020 compared to 2019. That means test has to be documented at the time of forgiveness in order to have the loan forgiven. But it is not necessary to document right now in order to acquire the loan. So we can get them out quickly and rapidly without whether or not you finished your fiscal year accounting or those types of things. We can get moving on those things. Both programs are funded by $284 billion in CARES 2. And I don't know the exact use up yet. The last I heard was about $90 billion on Monday. I do expect it to run out again at some point here in the next week or so. And so my best advice as a public official is to reach out to whatever financial institution you serve. If you have a local business, even if you are a nail tech and you had a net income in 2019 of $4,000, okay, and you don't feel like you're eligible for anything, the fact is that you are. And the fact is that I know that the institutions are out there to help you, and I encourage you to ask the questions and to take advantage of every opportunity you have to get any support that is available out there within the system and within this project. That would be my best advice.
I knew you'd have more info than I did.
Unfortunately, I know that one like the back of my hand. But I did not want to bring it into council without being asked, and I do appreciate you asking. And with that, we will go ahead.
Can I ask you one quick question in regard to that? The time frames or deadlines that they would be estimated to, be able to put in for that loan.
Okay, so the program will be open until March 31st. The applications are open to any financial institution at this point. So we did have a small window of reservation for local community institutions the first week, which was advantageous because I know many of us were able to get our applications in and processed during that window that closed on MLK at the end of that holiday. What we are today is now anybody can apply through the fintechs. When the money runs out, the money runs out, but if it doesn't run out, it's until March 31st. And then you have 24 weeks as your covered period in which to use the funds, which is 6 months. And again, you only have to use 60% at a minimum for payroll. You can use the other 40% for other covered operating expenses. And you don't have a first payment on that loan until 10 months after the end of the 24-week period, which means that the first estimated payment, if for some reason you had a challenge with forgiveness or anything else, would be May of 2022, roughly 16 months out. And like I would say, the program itself, I have to abide by the guidelines provided to me by the SBA, but I would encourage anybody who has a business that took a PPP-1 to give it a strong look at whether or not a PPP2 loan is in their best interest. Okay. With no more PPP, I'll go back and process some PPP, and we'll call this meeting adjourned. Have a good evening.
Good.